Hello everybody. I'm Dr. Shrikant Shetty, Senior Consultant and Head of Cardiology at Sakra World Hospital. So we are going through an epidemic of diabetes where a large population is suffering from diabetes and overweight. It is a peculiar phenotype that we see in our country both amongst men and women, where there is concentration of fat around the abdomen. So how do we identify that the fat is concentrated primarily around the abdomen? This is by measuring the waist circumference and by using what is called a waist-hip ratio. Those who have abdominal obesity, they would be at higher risk of heart diseases. What do we need to do to prevent abdominal obesity? To a certain extent, abdominal obesity is determined by genetics. However, genetics manifest more strongly in what is called a obesitogenic environment. That means if you are not exercising, if you are consuming food that is rich in simple starch, if your diet contains a higher proportion of carbohydrates, saturated fats and fried food, if you do not eat sufficient fiber in your diet, if you are not exercising, then you are more likely to develop obesity, particularly abdominal obesity. Abdominal obesity is associated with generalized inflammation, which we are aware also promotes coronary and atherosclerosis in the peripheral vascular and in the cerebral circulation. So people who have a higher waist-hip ratio, they are at a higher risk of developing heart attacks and strokes. Thank you.